Good afternoon, everybody. This is Christian Roberts. I'm back with another video, and today we are going to be discussing understanding tubulin in cell division and Oncovin's mechanism of action. So we're talking about the activity of the tubules within the cell and what Oncovin's job is regarding cancer. So basically, Oncovin, in other words known as vincristine, it is considered a basically an antibiotic drug that is used for chemotherapy. And what it does is stops or slows down cancer cell growth. So what Oncovin is, it specifically goes for certain enzymes that could stimulate the cell growth during cell division. So that's what Oncovin is there for. It's really to help people with leukemia or people that's dealing with breast cancer or all types of sorts of cancers, really, because when it comes to cancer, the purpose of cancer is cell division and cell growth while the cell is divided. So as I move on, I kind of want to go into detail of what is tubulin. So, according to research, tubulin is basically it is considered a protein, or it's basically a number of proteins that is basically consist of globular proteins. So what it does is it basically have two types of tubulin, which is alpha and beta tubulin, and they come from heterodimers. And what they do is they assemble into dynamic microtubules and perform multiple important cellular functions such as structural support, pathway for transfer, and force generation into cell division. So you see how I said we talk about what tubulin is, then we're going to talk about the structural protein, then the key components of the microtubules. Then we can also talk about the roles of tubulin in cell division. And I will say this, in mitosis, the chromosome movement and the segregation are orchestrated by a specific structure known as the meiotic spindle, which is composed of a bipolar array of microtubules. So during mitosis and even meiosis, when the tubules basically separates, that's when we're going to have cell division. And if they're not separated properly, then there's a higher chance that that cell might be undergoing cancer. So while we move on, before I move on, I want to talk about there's two types of tubulin, which is the alpha tubulin and the beta tubulin. And basically, when we looking at is these right here, we're talking about basically mitosis, meiosis one and two. That's basically what this whole thing is talking about. So as I move on, I want to talk about the mechanism of action of oncovin. So basically, the oncovin binds into the tubulin, which is going to cause specific interactions with the tubulin dimers, which is the heterodimers, and the heterodimers is going to prevent the polymerization of the tubulin, and it's going to inhibit the enzymes of cell division. And once it's inhibited, that means the meiotic spindle formation will be disrupted, and then the cellular arrest will occur during the stage of metaphase, which will introduce apoptosis in dividing cells, and apoptosis, which is cell death. As we move on, this is how the mechanism of action goes. See how over here on my left side, you see meiotic arrest and cell and meiotic death. That's doing the S phase, G phase, and the M phase. But doing G1, then you see the cell cycle arrest. Right here, this side is basically cellular division, cell growth, and this side is when the vincristine, which is oncovin, takes place. And see how once the vincristine binds to the tubulin, and it would inhibit the tubulin polymerization, which will lead to cell death. So basically, the purpose of it is to kill the whole cell, just so it can prevent the cell from affecting other cells and causing the cell to continue to divide. And see right here, this is the actual molecular structure of oncovin. And see, this is the more clearer molecular structure of oncovin. See, it consists of nitrogen and hydrogen groups and oxygen groups, and it also consists of methyl groups as well. So when we talk about the oncovin, let's talk about the clinical applications. They are treatments of cancers, but it's used in various types of cancer, like I mentioned earlier: leukemia, breast cancer, prostate cancer, lung cancer, any form of cancer. Anything regarding cell, when the cell is growing while constantly dividing, that's cancer. there's a whole bunch of therapies that you can actually go to. There's a whole bunch of oncologists that you can speak with regarding the processes and how much dosage you can take with Oncovin and what it does. And you can also manage the sickness of leukemia, lymphoma, and other solid tumors. And you also have to keep in mind the limitations. So honestly, the list right here that you see, this is all that you should be able to talk with your doctor about. Anything that you have in question or you have in mind, especially what medication you take, especially if a person that is undergoing some type of cancer, it's best to ask these type of questions because then you can have a better efficiency level, and you can have better options instead of limitations. You can have more options instead of just being limited to certain things, and that's including your insurance, that includes payments and everything. See, doctors now, especially in this time period, are making this easier for people, well, cancer patients, just so they can be more comfortable, just so they can still be taken care of. And also, when you take Oncovin, keep in mind of the side effects and toxicity, which is why there are certain limitations. The only thing that should be limited is how much that person is inducing the Oncovin. That's the only thing. Other than that, Oncovin, it helps, and it helps relieve or stop the cell from continuously dividing, just so the whole cancer itself will not continuously be broader or broadened. So as we move on, I want to talk about the conclusion and future predictions. We recap the essential roles of tubulin in the cell division. We know what tubulin is, and we know the types of tubulin. And there's many forms of tubulin as well. That's considered gamma tubulin, sigma tubulin. It's all types of forms, but the most popular ones is alpha and beta tubulin. And we also discussed the implications for cancer treatment and future research. Like I said, Oncovin is the most popular drug antibiotic that is used to treat people, especially doing chemotherapy. So we know what that is, and we know how they works, and we know what certain enzymes they're supposed to attack. It's supposed to antagonize tubulin polymerization. So as long as you know that the purpose of Oncovin is to stop the enzymes that can further stimulate tubulin polymerization, which can lead to cell division and cell cancer development. And I am done. This is my resource cited. This is where I got all my information from. And I hope that you was able to enjoy this video. And basically, I don't have nothing else to say, but just to go speak with your clinician or doctor or people who feel have certain symptoms. Go to your oncologist, and they can help you better. It's somebody that is expert, that have to understand it, that know what they're talking about. That's the best advice that I can tell you regarding this. And otherwise, but we know that Oncovin is, or vincristine is the helper. Is the main thing that's going to help a lot of people, and it actually has helped a lot of people within the last 15 to 20 years, considering the fact that technology has been invented and has been regenerated over time. So now we have the technology and the finances and the resources and the connections that we have compared to back then. A lot of people are more there. They're more cancer survivors, and luckily and thankfully, fortunately, without Oncovin, a lot of people there probably would have been more people who would have succumbed to it. So let's be grateful and show appreciation to the people who've discovered Oncovin. I wish I would have mentioned that early on, but I don't have nothing else to really discuss because y'all have learned, and I hope that y'all have learned something on today. And I will end this video, and thank you, and I hope you have a good day.